Hello, and thank you for the opportunity for me to speak with you today about uh, 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 an overview of concepts in vaccine diplomacy and this very aggressive rise in anti-science and how we integrate this into the geopolitics of vaccines and vaccinology. Just a word about who I am. I'm a vaccine scientist and co-director with Dr. Mary Elena Batazzi, my science partner for the last 20 years at the Texas Children's Center for Vaccine Development, which is a research arm of our National School of Tropical Medicine in the Texas Medical Center, which is one of the world's largest medical centers, a medical city of 60 institutions and more than 100,000 employees. And our labs are in the major research building of Texas Children's Hospital, where I've spoken to this group before about vaccines for parasitic infections such as schistosomiasis and hookworm and Chagas disease. And in fact, we had actually adopted a coronavirus vaccine program about a decade ago in collaboration with the New York Blood Center developing SARS and MERS vaccines. And now we've been able to turn this around for a low-cost COVID-19 vaccine for global health, which I'll talk about. But before then, I want to give a general overview of where I see things heading. You know, we have made enormous progress in vaccinating the world, especially the world's children, against ancient childhood scourges such as measles, pertussis, tetanus, diphtheria, Haemophilus influenza, type B meningitis. And of course, so much of that success is due to the progress of the Gavi Alliance, the Global Alliance for Vaccines and Immunization, which was launched with $750 million from the Bill and Melinda Gates Foundation. And it's this major consortium of the pharma industry, academic partners, developing country vaccine manufacturer network partners, as well as the United Nations agencies. And it's been highly successful. Just look at the impact. These are the most recent enumerations from the Institute for Health Metrics and Evaluation, and you can see dramatic declines in the number of children dying every year from measles and pertussis and tetanus and diphtheria and meningitis. Those pictures on the right are some fantastic black and white images from the Brazilian photographer Sebastião Salgado, who spent time photographing kids getting their vaccines, especially the polio vaccines. And I like it from the expression on the parents' faces and the full range of human emotion there. And you can download a lot of these images from the internet. It came from a photo exhibit at the Pan American Health Organization more than 10 years ago. Now, I've written I also like to write books, and this is my latest one called Preventing the Next Pandemic, Vaccine Diplomacy in a Time of Anti-Science. And its major premise is that despite these gains in many regions of the world, we have actually sustained losses in global public health, but it's due to 21st century drivers or forces that we ordinarily do not get trained to think about as vaccine scientists or as physicians or physician scientists. Things like poverty and war and political instability and urbanization, deforestation, climate change, and anti-science. And although we're hearing now about climate change, one of the observations I make in the book, it's not so much climate change acting in isolation, but in combination with these 21st century social determinants. So these are some of the hotspot areas, not even hotspots, these are pretty large regions of the world where we are seeing the return of vaccine preventable diseases and neglected tropical diseases as well. And for instance, on the Arabian Peninsula, where I served as U.S. science envoy in 2015, 2016, at the time of the ISIS occupation, this had caused major collapses in health systems and return of polio and measles, as well as vector-borne diseases such as cutaneous leishmaniasis, which the locals called Aleppo evil, and this had become hyper-endemic. You also saw this as a consequence of the Syrian civil conflict, as well as what's going on in Yemen, the proxy wars between Iran and Saudi Arabia, and this has been a huge driver. The other piece to this is unprecedented temperatures at 50 degrees Celsius in parts of the Middle East, Central Asia. This is driving people away from ancient agricultural pursuits into cities, and that in itself is a destabilizer. Or what Jeffrey Gettleman of the New York Times calls Africa's unwars, to remark on the fact that it's not so much conventional warfare between countries or even civil conflict, but really armed banditry on civilian populations, leading to the return of diseases such as sleeping sickness and vaccine-preventable diseases, including polio and measles again. Or what's going on in Central Latin America, particularly in Venezuela, with the socioeconomic collapse of the Maduro regime, people fleeing across the border into the Amazon region of Brazil or into Colombia, where they're bringing measles, breakthrough measles, and other vaccine-preventable diseases to ancient indigenous populations, the abrupt rise of malaria and neglected tropical diseases, or even in Texas and the Gulf Coast, where this has become a major center for climate change and urbanization and this rise in anti-science. And all of this really was well underway for the last few years, even before the pandemic began, in the COVID-19 pandemic began in 2019. So the point is, COVID-19 is more of a culminating event rather than something totally extraordinary. And of course, now we're dealing with the catastrophic impact of the Delta variant, which is certainly decimating the United States right now, particularly in the southern US and in Texas, where I live and work. We're just getting hit very, very hard right now. And unfortunately, a lot of it happened because of low vaccination uptake, which I'll talk about. But even aside from that, we are seeing declines in vaccine efficacy versus the Delta variant compared to what's now known as Alpha, formerly the B.1.1.7 variant from the United Kingdom. But I think in addition to the decline in efficacy versus Delta from 2 doses of either the 2 mRNA vaccines or the J&J vaccine, we are also seeing declines in efficacy against infection. And now Israel's reporting a decline from over 90% to 40 to 50%. And what's less clear, though, is what the impact is on breakthrough hospitalizations. And the scientific community at this point is going back and forth about the evidence for that, some finding evidence of significant levels of breakthrough hospitalizations, others dispute that. And this goes a long way towards making decisions about the potential need for the third immunization. And of course, as we'll talk about in a minute, the implications of that for vaccine equity. And here's the situation that we faced. We're very much 2 Americas. We're in the Northeast and the West Coast. In the northern part of the country, the West Coast, we're doing pretty well in terms of vaccinating the American people. But in the southern region, mostly because of defiance or refusal, because of political leanings, we're not doing a good job at all. And COVID-19, the Delta variant, is just ripping through this part of the country. And we'll talk about the role of anti-science in helping to promote that. So that's our situation in the US. But we also have to now recognize that, focusing entirely on our own nation is not going to be adequate. And we need to give better thought to this concept of vaccine diplomacy, which is something I've devoted my life to, including in 2015, 2016, when I served as U.S. envoy for the State Department for vaccine diplomacy in the Middle East and North Africa, building capacity for vaccine development, particularly on the African continent, which is so lacking right now. And we're clearly seeing the urgency for this play out. This is unfortunately our situation right now, where we are vaccinating North America, of course, with those gaps in the southern US as well as Western Europe, the Nordic countries, and the UK. But if you look at the global South, we're doing a terrible job, and especially on the African continent, where almost no one is vaccinated yet, even though we're 2 years into the pandemic. Not doing much better in parts of Southeast Asia, Vietnam, Cambodia, Indonesia, and profoundly underachieving in Latin America. And so I thought I would talk for a minute about how I think we've come to this situation, and I think part of it is we never really did the simple back of the envelope calculation that's so important to do, which is to understand the magnitude of what we needed to accomplish. If you look at on the bottom, the size of the world's low and middle income countries, with 1.1 billion people in sub-Saharan Africa, 650 million people in Latin America, 500 million people in the smaller low-income Asian countries. We're talking about 2 to 3 billion people. That's 5 to 6 billion doses of vaccines. And I think there was such an emphasis on innovation and making quality, exciting mRNA and adenovirus vectored vaccines that I don't think there was enough thought given to ensuring that there was the balanced portfolio with simpler and older technologies that we know we could vaccinate now, not by 2023 or 2024, in addition to the problem of not doing a good enough job sharing doses. But, again, sharing alone is still not going to be adequate to get us to that 5 to 6 billion benchmark. And so the way I often say this is, we did make some exciting vaccines, mRNA vaccines, adenovirus vectored vaccines, what I sometimes call the shiny new toys on the bottom right, but we needed to give attention in parallel to high quality older technology vaccines, as we say in the US, the matchbox cars, to vaccinate the world. And as we get better at learning how to scale mRNA technology. So I've been pushing very hard on the Biden administration to do a better job sharing our mRNA vaccine doses, but in parallel, also let's figure out what we could scale up for the world right now and actually enlarge the pie, build more vaccines. And one of the vaccines that we're quite excited about is our recombinant protein vaccine, which is now been licensed to Biological E in India and Biopharma in Indonesia and elsewhere. And the one with Biological E is named Corbevax now, and this is now being scaled to 100 million doses a month in India. And now we're making arrangements with at least half a dozen other countries to hopefully provide recombinant protein vaccine for the world. It's a recombinant protein, the receptor binding domain on alum, together with at least one immunostimulant, such as a CpG oligonucleotide. And here it is. It's called Corbevax in India. It's now completing phase 3 clinical trials. And as I said, the Biological E is producing it. It uses Pichia pastoris fermentation technology, an old school technology similar to that used to make recombinant hepatitis B vaccine all over the world on aluminum hydroxide. And in the case of Corbevax, it's CpG from Dynavax, although other countries may have access to other immunostimulants. And so this is an odd role for us, that we are on daily conversations with low and middle income countries in order to identify pathways by which we can do the technology transfer of our production cell bank to these countries so they can scale it up for their populations. And we're doing this predominantly with Asian countries, now in discussions with South Africa as well. And it's very gratifying. At the same time, it's very upsetting, because the calls that we get from Ministries of Health and Ministry of Science is such desperation for having high quality COVID-19 vaccines. And so it's a role we welcome, but I think not one that I think in many respects we thought we might have the U.S. government more actively involved in this project. So we've got some great protection in non-human primates that we just published with upon COVID-19 challenge, and we seem to be getting immunogenicity in terms of virus neutralizing antibody titers right up there in similar ranges as some of the best performing vaccines, and strong neutralizing activity against many of the variants. I don't have the Delta variant on this slide. We have new data now showing very high levels of virus neutralizing antibody versus the Delta variant as well. And so the potential advantage of Corbevax, which is made in India, but similar to the other ones we're licensing to other countries, is ease of scalability of production. It's not that high a bar to produce more than 1 billion doses, simple refrigeration, and a 40-year track record of safety based on the recombinant hepatitis B vaccine. And the other exciting thing about this is we're looking at this as a pediatric vaccine as well, because the hepatitis B vaccine has been given to young children and infants for decades. And we think there'll be a high degree of parental acceptance for that. And also the cost, which we think we can bring down to $1.50 a dose. So we think we're hoping it'll be one of the least expensive of the COVID-19 vaccines. Now, in parallel, what we're also doing is working very hard to combat the rise in anti-vaccine and anti-science aggression, particularly in the United States. And those of you who've heard me before know that this has been a long-standing fight going up against anti-vaccine groups, because I have 4 adult kids, including Rachel, who has autism and intellectual disabilities, and wrote a book a few years back called Vaccines Did Not Cause Rachel's Autism, to diffuse those fake assertions between vaccines and autism. And that's put me in this pretty tough fight combating the anti-science. So that's, I think, when if I look back on my life, getting my MD PhD, I always wanted to make vaccines for neglected diseases, but I never thought that fighting anti-vaccine activities would become a major activity. But that is the reality. And of course, in the modern sense, this began 23 years ago with the publication of a paper that was ultimately retracted in The Lancet by Andrew Wakefield and his colleagues, asserting that the measles, mumps, rubella vaccine had the ability to replicate in the colon, cause inflammation in the colon, and this then led to, at that time it was called pervasive developmental disorder, and now we refer to it as, now we call it autism or autism spectrum disorder, ASD. And it's been really interesting over these last 2 decades to follow how the anti-vaccine, anti-science movement evolved, or really de-evolved, from starting with version 1.0 of vaccines and autism, and then more recently, in the last 6-7 years, taking on a political dimension in the United States under this banner of health freedom, and now it's globalized. So every country, I think, has, as people like Professor Heidi Larson have pointed out, has its own unique version of declines in vaccine confidence or vaccine hesitancy. I think the component in the U.S. is by far the largest and most ominous and best organized, and this too has its unique flavor. So let me take you through versions 1.0, 2.0, and version 3.0. So version 1.0 is that claiming vaccines cause autism. And within that space, there's a lot of heterogeneity. So it started with the MMR vaccine, measles, mumps, rubella vaccine, in the late 90s, early 2000s. And then it made a pivot from MMR vaccine, although that thread is still with us, to claiming that it was thimerosal preservative in vaccines. And each time these assertions were made, the scientific community invested a huge amount of time and effort and resources in order to show that kids on the autism spectrum were no more likely to have gotten the MMR or thimerosal containing vaccines than kids not on the autism spectrum. And similarly, kids who get MMR or those vaccines, thimerosal containing vaccines, are no more likely to acquire autism than kids who don't. And each time we do that, the anti-vaccine groups pivot or they move the goalposts. They say, okay, well, what about spacing of vaccines too close together, or alum in vaccines? And each time, we try to respond, and you start playing this kind of Pyrrhic game of whack-a-mole. And more recently, there's even been some movement away from autism entirely, claiming that it's about the human papillomavirus vaccine, that it causes infertility or autoimmunity. And if that sounds familiar, with some of the fake assertions around COVID-19. There's a reason for that. It has to do with the anti-vaccine group simply copy-paste what works for them in this Pyrrhic sense on HPV and glom it onto COVID-19 vaccines. And of course, this is when I got involved, is because that's on the upper left. That's me with Rachel, my daughter with autism and intellectual disabilities, and writing this book that has been very tough not only on me, but my wife Ann and I and our family, in terms of debunking the false claims. And the book Vaccines Did Not Cause Rachel's Autism does a deep dive explaining all the science, that it's not MMR or thimerosal or spacing vaccines too close together or alum. And this created a lot of enmity and enemies, right? And they now refer to me as the OG villain, the original gangster villain. So that's my new nom de guerre, I guess, from the anti-vaccine groups. And one of the things that I do in the book is explain what autism is, and we performed whole exome sequencing on my wife and I and Rachel in association with Baylor Genetics. The exons are the 1% to 2% of the genome that encodes proteins, and it's a very powerful technology in terms of discovering autism genes. And there's been now about 100 genes for autism that have been reported through this process. On the upper right is a paper from the Broad Institute at Harvard MIT, reporting on these genes. All but one are expressed in the cortex, all expressed in early fetal brain development. They regulate gene expression or neuronal communication. Most are expressed and enriched in early and excitatory and inhibitory neuronal lineages affecting synapses. Many are involved in the neuronal cytoskeleton. So when we did this for Rachel, this is the publication from the American Journal of Medical Genetics reporting on Rachel's gene, and it was an opportunity to then identify others on the autism spectrum with a similar gene. This is a non-red cell spectrin, a neuronal spectrin, which again gets to the whole idea of the neuronal cytoskeleton being very important in early fetal brain development. The point is these are events, genetic and epigenetic events that happen early on in pregnancy, well before kids ever see their vaccinations. And unfortunately, and that did have some effect. And because we did see that while a lot of parents were were opting out of getting their kids vaccinated, it got to the point where so many kids had opted out, like in Southern California on the bottom right there, that it caused a massive measles epidemic in Orange County in 2014 and 2015. And this finally woke people up to saying, look, we're going to have to require vaccines for kids to go into schools. And so the California legislature closed that loophole and demanded that if kids are going to go to schools, they have to be vaccinated in Orange County and elsewhere. But that in the anti-vaccine movement was getting frustrated and felt they had to re-energize. And they did this by taking on version 2.0, which had nothing really to do with autism, but it was around this fake concept of health freedom, medical freedom, that you can't tell us what to do about our kids. And this is what we're dealing with even until today. So it really amplified where I am in Texas, where by the 2010s, so many parents had opted their kids out of getting vaccinated that it had become a dangerous situation. We have over 70,000 kids denied access to their vaccines in the state of Texas, and this doesn't even talk about the more than 300,000 homeschool children that we have. And it was particularly bad in the center of the state, in that area in black there on the suburbs of autism. So this became kind of the epicenter of the anti-vaccine movement under this banner of health freedom, medical freedom. So political action committees formed, which were linked to the Republican Tea Party. And this became very much a politicized movement. And this then gets very difficult for us as physician scientists to discuss, because all of our training is not to talk about Republicans and Democrats and that sort of thing. But that is the reality. So under health freedom, medical freedom, we've now seen this direct translation into declines in COVID-19 vaccination rates. So there have been several analyses that have been done by Charles Gaba and others that show that, in the U.S., we refer to Democratic majority states as blue states and Republican majority states as red states. And you can see there's very much a red state, blue state divide in terms of vaccination rates. And it very much goes along the lines of the 2020 election. So the higher the percentage of Trump voters, the higher the rate, the lower the level of vaccination, and the more unvaccinated people. So it's a very striking range, and it very much, because the red states congregate in certain parts of the country, like the southern United States and in the Mountain West, that's now in the southern states, that's where you're seeing this massive COVID-19 surge. So it actually has significantly affected the health of the country by this partisan divide under health freedom, medical freedom, bringing back COVID-19 to the South. And now we're seeing in the US this kind of mounting anti-vaccine, anti-science aggression. So it's not only a matter of not refusing to take COVID-19 vaccines. We're also now seeing from the political right targeting of scientists, and especially including vaccine scientists and COVID-19 scientists. So, they're certainly targeting people like Anthony Fauci. I'm a frequent target, and it's become more and more mainstream from the conservative side. So we're seeing the conservative news outlets like Fox News and Newsmax target scientists and the science, members of the United States Congress, governors. And this has taken sort of a dark turn here in the United States, especially in the southern United States, where it's so prominent. And I don't quite know where it's going, but one of the things that we have seen is that it's starting to globalize. So we're now seeing anti-mask, anti-vaccine rallies in Western Europe, in London, Paris, and Berlin. The one in Berlin, according to the New York Times and the BBC, has been linked to QAnon and political extremism on the far right, even neo-Nazi groups. So this link to far right-wing extremism and being against vaccines and anti-science is a new reality for our 21st century. And I think we have to be prepared to talk about it in an open way if we're going to hope to solve it. And of course, that's not complicated enough. So now we've got reports from US and British intelligence that the Putin government and the Russian government is using this as a wedge issue to promote instability in the country. And they're using what's called weaponized health communication against vaccines and science and scientists to ramp up the discord, to actually create greater divisions within the United States. And unfortunately, it's having an effect. So what's now happened is the anti-vaccine, anti-science movement has taken on this, what I call this three-headed monster, which from the bottom up are state actors like the Russian government, the far right-wing extremism, and PACs means political action committees, which are now mainstream across the GOP. That's initials for the Republican Party. And also the Center for Countering Digital Hate. And it's extraordinary that we have to have an organization called the Center for Countering Digital Hate estimates that we have the top dozen anti-vaccine non-governmental groups have around 60 million followers. So these are no longer mom and pop grassroots organizations. These are well-oiled, well-funded, well-organized campaigns coming from these three sources, which are driving down vaccination rates for COVID-19. And now I worry about spillover for other vaccines happening globally. So I've been writing and reporting on this, how not only is it going global, but it's a killer. And the point is now 630,000 Americans have lost their lives from COVID, not only because of the SARS-2 coronavirus, but because of defiance of masks and social distancing and now vaccines. And have been writing like this article in Nature to say that we've got to take another look at this. And so much of our effort is around amplifying the message, the pro-vaccine message. And yes, that's important. But I think we also have to look at what we need to do to counter the three-headed monster. And to bring in people from other branches of the U.S. federal government, because I think the health sector alone is not going to be able to take this on. We need to bring in people in the U.S. government from departments of Homeland Security and Commerce and Justice and the State Department, and same with the UN agencies. This goes beyond, I think, the remit of the World Health Organization. We're going to have to bring in other branches of the UN agencies. So I'm sorry to end on that kind of sour note. I am more optimistic than I may sound, but I do think we have to figure out a way to confront this mounting anti-vaccine, anti-science empire, because on its own, I don't think it's going away. So thank you for this opportunity to speak with you. It's a real honor, and wish everybody all the success in the world in your work. Thank you.